Is anxiety a mental illness? Anxiety is something that many people experience at different times in their lives. But when it crosses a certain threshold, it can become a disruptive force. For some, it's a momentary feeling, but for others, it can become a mental health challenge that impacts their daily lives. The question, is anxiety a mental illness, is a topic that has gained a lot of attention in recent years as society continues to explore and understand mental health better. This essay explores anxiety's nature, its connection to mental illness, and how we can approach it with empathy and knowledge. What is anxiety? Anxiety is essentially a feeling of unease, worry, or fear. It's an emotional response to perceived threats or situations that make us feel uncertain or unsafe. This feeling can be temporary, like the nerves before a big presentation, or it can become more persistent, affecting daily routines and behaviors. While occasional anxiety is normal, anxiety becomes a concern when it turns into something more chronic, affecting how a person functions. This heightened form of anxiety can lead to physical symptoms like an increased heart rate, trembling, and sweating. Over time, it can start to interfere with a person's ability to work, maintain relationships, and engage in everyday activities. Anxiety. As a mental illnesses are conditions that affect a person's thinking, feeling, or behavior. They can disrupt daily life and sometimes require professional treatment to manage effectively. The key factor that defines a mental illness is whether the symptoms are severe enough to impair functioning. Anxiety disorders, according to the American Psychiatric Association, are among the most common types of mental illnesses. They are more than just momentary bouts of worry. When anxiety becomes excessive, persistent, and irrational, it may be classified as an anxiety disorder, which is a recognized mental illness. Some common types of anxiety disorders include generalized anxiety disorder, GAD, characterized by excessive and uncontrollable worry about everyday situations. Panic disorder involves recurrent, unexpected panic attacks, episodes of intense fear or discomfort. Social anxiety disorder, a fear of being judged or scrutinized by others often, leading to social withdrawal, specific phobias. Intense, irrational fears of specific objects or situations, like spiders or heights. Obsessive-compulsive disorder, OCD, involves intrusive, unwanted thoughts, obsessions, and repetitive behaviors, compulsions. Post-traumatic stress disorder, PTSD, anxiety that follows a traumatic event, leading to flashbacks, nightmares, and heightened arousal. These disorders can have a profound impact on a person's life, and they often require treatment from a mental health professional to help manage the symptoms. The recognition of anxiety as a mental illness comes from the fact that it interferes with a person's well-being, and when it becomes chronic, it meets the criteria for a diagnosable condition. How anxiety becomes a mental health concern. Does anxiety shift from being a normal response to stress into something more serious? It's not always easy to pinpoint the exact moment, but there are a few key signs that may suggest anxiety has crossed the line into a disorder. Chronic and intense worry. When worries are persistent and occur almost daily, even in the absence of obvious stressors, it might point to an anxiety disorder. Physical symptoms. These may include a racing heart, dizziness, difficulty breathing, and even gastrointestinal issues. Over time, these physical symptoms can be distressing. Interference with daily life. Anxiety becomes a mental illness when it impairs one's ability to go about normal activities, whether that's going to work, school, or engaging in social situations. Avoidance. Behaviors. People with anxiety disorders often go out of their way to avoid situations that trigger their anxiety, which can lead to isolation and a reduced quality of life. Sleep disturbances. Anxiety can significantly affect sleep, leading to insomnia or restless sleep patterns. The physical and psychological effects of anxiety. When anxiety is more than just a temporary feeling, it affects the body and the mind. The physical effects of anxiety can be incredibly distressing, and over time, chronic anxiety can contribute to serious health issues, such as cardiovascular problems, digestive disorders, and a weakened immune system. From a psychological standpoint, anxiety can make a person feel overwhelmed, helpless, or unable to cope with their emotions. The constant sense of dread or worry can also lead to feelings of low self-worth and depression. This is why it's so important to recognize when anxiety is becoming more than just a passing feeling. It's a mental health issue that deserves attention. The treatment of anxiety disorders. Thankfully, anxiety disorders are treatable. There are several approaches that can help people manage their anxiety and regain control over their lives. These treatments may include cognitive behavioral therapy, CBT. One of the most effective therapies for anxiety, CBT helps individuals identify and change negative thought patterns that contribute to their anxiety. Exposure therapy. This type of therapy involves gradually exposing the individual to the source of their anxiety in a controlled way, helping them build tolerance and reduce fear. Medication. For some individuals, medications such as selective serotonin reuptake, inhibitors, SSRIs, or benzodiazepines may be prescribed to help manage the physical and psychological symptoms of anxiety. Mindfulness and relaxation techniques. Practices like meditation, yoga, and deep breathing exercises can help calm the body and mind, reducing anxiety. Lifestyle changes. Regular physical activity, a healthy diet, and good sleep hygiene can all contribute to improved mental health. Treatment is often most effective when it combines therapy, medication when necessary, and lifestyle changes. Every individual is different, so finding the right approach may take time. The stigma around mental illness and anxiety. One of the reasons why many people may struggle with anxiety is the stigma surrounding mental health. For years, mental illness was often misunderstood or dismissed. Anxiety, in particular, is sometimes minimized as just worrying or being overly sensitive. However, this view ignores the fact that anxiety can be a debilitating illness that impacts an individual's well-being. Breaking the stigma around mental health is essential to helping people seek the support they need. People with anxiety disorders should not be ashamed or embarrassed to seek help. Mental illness is just that, an illness, and, like any other medical condition, it deserves to be treated with care and compassion. The importance of supporting. Those with anxiety is just as important as seeking treatment. Family, friends, and loved ones can play a critical role in helping someone manage their anxiety. Offering a listening ear, being patient, and encouraging treatment can make a world of difference. When someone is struggling with anxiety, knowing they have support can help reduce feelings of isolation and fear. It's also important to remember that those living with anxiety are not alone. Millions of people around the world experience anxiety disorders, and with the right resources, it is possible to live a fulfilling and healthy life. So, is anxiety a mental illness? Yes, when it becomes chronic, excessive, and interferes with daily life, anxiety is classified as a mental illness. However, it's important to understand that anxiety is treatable. Whether it's through therapy, medication, or lifestyle changes, individuals with anxiety disorders can lead fulfilling lives with the right support and treatment. It's crucial to approach anxiety with empathy and to recognize that mental health struggles, like physical health struggles, should be met with understanding and care. By continuing to educate ourselves and reduce stigma, we can create a world where mental health is prioritized, and those who struggle with anxiety can find the help they need to thrive.